So my main interest really in terms of contact lens deposition really goes back to my time in practice. I came into clinical practice in the mid-80s when we were starting to be involved in the use of high water contact lenses in clinical practice. It was before the days of disposable lenses, and so what I began to realize is that with those high water contact lenses, whilst we were getting more oxygen to the cornea, what we were finding is that many of those lenses actually fairly heavily deposited with components from the tear film. So with that, I actually managed to team up with a group in Aston University in Birmingham and take the lenses from my clinical practice up to the university. I did that a couple of days a week, did my PhD part-time. I did the clinical work in the practice looking at how the lens is deposited. Then I would collect them after a set period of time, take them to the lab, biochemically analyse them. What we were able to show was that there was really quite a big difference between lenses replaced after 3 months compared with a month. And then what we did was look at the kinetic build-up of those deposits, both proteins and lipids over a period of time. We were actually able to show that now, during the period of time that we typically replace lenses, which is in a month or less, how that kinetic build-up of deposits occurred. And we were actually amongst the first groups in the world that were able to show that silicone hydrogel lenses primarily deposit very low levels of protein, much higher levels of lipid, whereas conventional hydrogel lenses typically deposit a lot more protein and really very little lipid. And so that's where my interest in contact lens depositions kind of started and ended.